I'd like to invite you to this first part of a series of hopefully helpful, informative videos on intervertebral disc disease in dogs. My name's Paul Freeman. I'm a neurologist at the Queen's Veterinary School Hospital, University of Cambridge, with a research group looking at specifically aspects of intervertebral disc disease. We work very closely, and a lot of our work is indeed sponsored by Dachshund Rescue UK, and so they've invited us to record some short, hopefully informative videos for you. So here goes with the first one. Hopefully my PowerPoint will run through. Of course not. Now I want it to move on. Okay, so just a little bit of explanation about intervertebral disc disease. People talk about IVDD, stands for intervertebral disc disease, and I just wanted to really explain for people who have very little awareness of what we're talking about, what we mean by intervertebral disc disease. The discs are little spongy shock-absorbing structures that sit in between each vertebra of your dog's back. We also have them in our own backs, and they act as shock absorbers. They are, when they're healthy, you can think of them almost like a nice spongy, fresh jam donut. What happens in disc disease is that the donut ruptures, bursts, and the jam inside leaks out. And this is shown in two ways here. Obviously, the jam donut graphic, but also this image here. And what you can see here, the blue is the outline of the disc. The pink is the central part of the disc, and we talk about the outer annulus fibrosus and the inner nucleus pulposus. And when we talk about disc disease, particularly in Dachshunds, but in many other breeds as well, what's happening is the annulus is rupturing, the donut is bursting, and the jam, the nucleus, is escaping out this way. And it normally goes upwards. And unfortunately, as it goes upwards, what's sitting up here is the spinal cord. And so this material squashes and damages the spinal cord. And this is what we talk about when we are talking about intervertebral disc disease. Other words that people will use would be disc herniation, disc extrusion. What else can we talk about? Slip disc. These are all sort of synonymous expressions for intervertebral disc disease. But what we're really worrying about is this rupture and escape of the contents. Why do we see it so much in Dachshunds? Well, we know that somewhere between 15 and 20% of all Dachshunds are likely to suffer with some form of intervertebral disc disease during the course of their life. So a huge percentage of them, if you own a Dachshund, you're really looking at probably around a 1 in 5 chance that your dog will suffer with some form of intervertebral disc disease. May not be too severe. Fortunately, some of them are very mild and short-lived, but it's highly likely they're going to get it. Why? Well, we know that there's a major genetic component now, a specific genetic component has been identified, which is prevalent, very prevalent in Dachshunds, particularly in the UK. And we know as well that there are other factors involved. The discs in Dachshunds, as well as other breeds, become calcified very early in life. This means that whereas in the young, healthy dog, the disc can be thought of as a fresh jam donut, as dogs get older, the jam becomes solidified, the jam becomes crystallized, and what's happening is that inside the disc, calcium is being laid down, just like the scale in a kettle in a way, and that soft, spongy, gelatinous material that should form the inner part of the disc, the nucleus pulposus, becomes calcified, becomes crystalline, becomes hard, and the disc becomes brittle, becomes less able to withstand the normal shocks and strains of everyday life. So your Dachshund or your French Bulldog or whatever other little dog you've got, that we know there are many breeds that are prone to this, simply just running down the garden or going for a normal walk or hopping down off the sofa, one of those discs can burst. One of the donuts can leak, and that inner calcified nuclear material can escape out of the disc, and it can cause damage to the spinal cord in doing so. I've put lifestyles on this slide now. The Dachshund Breed Council a few years ago conducted a major sort of lifestyle survey of owners of Dachshunds, and a few different factors were identified as being potentially risk factors for your dog suffering with a slip disc. One of these that's been reported recently is neutering, and there has been a recommendation made that if you own a Dachshund, it's perhaps better not to have the Dachshund castrated or spayed too young. The evidence is not strong, but there is certainly some evidence that perhaps keeping them entire, at least until they're fully mature, so maybe sort of 18 months, 2 years old, may be beneficial. We know that if your Dachshund becomes severely overweight, this is a potential risk factor. And certainly, if your dog suffers with a slip disc, it is going to make it more difficult for them to recover if they're significantly overweight. So keeping them slim and fit is very important. And finally, exercising. Exercise is important, actually, and dogs which exercise regularly and well are actually less prone to slip discs than dogs that lead a more sedentary lifestyle. So exercising is important, but exercising in moderation, avoiding the sort of really significant sort of jumping and climbing is probably going to reduce the risk of a slip disc. All the evidence we have for this is relatively thin, but sensible precautions such as keeping the weight down, not neutering too early, and avoiding overly vigorous exercise, I think, are all potentially important. How do you know if your dog's suffering with disc disease or disc extrusion or slip disc? Well, what we want to avoid is them getting to this stage, as you can see in the video here, where the back legs have become pretty much completely paralyzed, and there's really very little movement going on there. This is, people talk about grades of disc disease, and you'll hear people talking about grade 1, grade 2, grade 3, grade 4, grade 5. I don't really like to dwell too much on the grades, because actually most of these grades don't really help us too much in terms of knowing what to do and knowing what the chances of recovery are. Fortunately, it's true to say that most cases of disc disease will recover, whatever treatment is offered, actually, and we'll talk about that in the future, but most of them will recover. The ones that have a significant chance of not recovering are the dogs that become completely paralyzed and lose the sensation in their back feet. And some people talk about this as grade 5 disc disease. But paralysis with loss of sensation, this is what we want to avoid. This is the scary one. This is where the chances of recovery are probably down to about 50-50, whereas with all other grades, chances of recovery, and by recovery we mean returning to a normal function, walking, running, exercising, chances of recovery are up around 90% for all other grades. So the grading system is not overly helpful. Symptoms of early stage disc disease would be signs of pain. So if your dog suddenly appears to be uncomfortable, reluctant to go out for a walk, reluctant to get out of his bed, often this can be confused with tummy ache, with abdominal pain, actually, and many vets also can misread the signs of back pain because it can be so difficult to work out whether the pain is coming from the back or coming from the abdomen. So watch out for this. That pain is normally the first sign, and then maybe weakness, wobbliness in the back legs, which, if you're unlucky, may progress to complete paralysis. And we'll talk about ways of preventing that in the future. In terms of the disease itself, I just wanted to mention this scheme. I've put a link here on the slide for anybody that's interested. The only thing that we have at the moment to try to reduce the incidence of this disease in Dachshunds is a scheme whereby we're encouraging breeders to have their dogs x-rayed, and we identify calcified discs on x-ray. Now, this is actually a CT scan, and I've got the image on here, which is an even better way of identifying calcified discs. And you can see these are the bones of the vertebrae of the backbone. These are the discs in between, and each of these shows signs of calcification. The white is what you see with calcification. So there's a lot of calcified discs in this dog. And this is what we want to try and avoid, because we know that the more calcifications that a dog has, the higher the risk of getting disc disease in the future, disc extrusion in the future. So there is a scheme now whereby breeders of Dachshunds can take their registered Dachshunds to a centre where they can have x-rays taken, and then the number of calcified discs reported, and then advice given regarding breeding. So if you're thinking of getting a Dachshund puppy, then it's certainly worth asking whether this has been done, because at the moment it's one of the few ways we have of trying to reduce the incidence of the disease. Something that we're working on at Cambridge is other ways potentially to try and reduce the incidence of the disease rather than just dealing with it once it's happened. But we're a little way away from anything major as far as that's concerned at the moment. Anyway, I think that's enough for this first video. So I'm going to say goodbye now, and we'll be back with another episode at some point in the future. So thanks for watching, and yeah, watch out for the next one.